My name is Leah Parker, and today I will be doing my abdominal assessment on my patient here. And I'm going to adjust the camera so that you can get a clear view, and then I'll ask him some of those pertinent questions. Okay. So Mr. Parker is here today for an assessment, and I've provided privacy for him. And I'm going to ask you your name and date of birth.
Tony Parker, 21272.
And are you currently in any pain?
No.
Okay. I will have provided a pillow for underneath his head, but kept his legs flat, and I'll ask him to keep his arms at his side. And he will have emptied his bladder completely before we started. Starting off, I'm going to take note of his abdomen for any distension, lesions, rashes, angiomas, the color and characteristic of his umbilicus. So I'll look at all those things. And then I will start by first auscultating his bowel sounds. Make sure the camera can see in all four quadrants. Good. And then I'm going to auscultate his aorta, his iliac artery, his renal artery, and his femoral artery, and I'll be using the bell of my stethoscope for that. Aorta, renal, iliac, and then deeper for his femoral, listening for any bruits or adventitious sounds. Good. Now I'll move back to percussion, where I'm going to listen over his abdomen. I'm going to percuss in all four quadrants. And I am expecting to hear tympany in all four quadrants, to which I do. And then I'm going to move to checking his liver span, and I will start at his mid-clavicular line, second intercostal, and I'm going to go vertically down. And I'm going to be percussing, and I should expect to hear some resonance over the lung fields, dullness when we hit the liver, and then again tympany in the intestines. Do I hear resonance? Just switching to dullness. And we move back to tympany. Good. Now I'm going to check his spleen and percuss there. For that, I'm going to go to the 6th intercostal space, in between the 10th intercostal space, here. And I should expect to hear dullness because we're over an organ. Now I'm going to move to light to deep palpation, light, moderate to deep. And I'm going to do that in all four quadrants, asking the patient to stop me if he feels any pain. With the two-handed method. A little bit more moderate. Are you having any pain?
No.
And deep. Good. From here, I'm going to go ahead and check his Murphy sign, and that's going to be at his right intercostal margin. And I'm going to be palpating very deeply and asking if he experienced any pain. If he did, that could be a sign of cholecystitis, hepatomegaly, or hepatitis. I'm going to locate his umbilicus and go to the lower right abdomen quadrant, and I'm going to palpate deeply there. Any pain?
No.
And that was his McBurney sign, and that would have shown us if he had any indication of appendicitis. I'm also going to go ahead and locate his aorta. So I'm going to go to the umbilicus and go above it And from here, I'm looking to see if there is any distension. If it looks like it's greater than 3 centimeters, then we will not be palpating so we don't risk rupturing an aneurysm. And I don't see that it's fine, so I'm going to go ahead and palpate. I'm checking for any kind of masses or aortic pulsations. All right, that looks good. So now we're going to check his costovertebral sign or costovertebral angle, and that'll be the last thing that we do. And for that, I'm going to have the patient sit up, and hopefully our camera will pick it up correctly. Good. We're going to go to the 10th rib, 10th intercostal space. And just to the left and the right of the spine, right there, I'm going to palpate gently and ask, do you feel any tenderness there?
No.
All right, so from there, with a closed fist, I can percuss and ask, do you feel any tenderness?
No.
And if he had tenderness, that could be a sign of pyelonephritis or a possible abscess. And that concludes our abdominal assessment. Thank you.